I think one of the hardest things about dyspraxia is just how much misinformation is out there about it, especially here in the United States. A lot of people really don't understand exactly what dyspraxia is and how it truly does affect people and how it's really not what most people think it is. There's a lot of misconceptions as well. So this video is going to be a lot less personalized and a lot more informative than my usual videos, but I feel like it needs to be said, especially when I'm going forward with this channel, because a lot of why I don't post often is simply because of all the misinformation and everything, and being able to talk about this openly is really hard when people don't really have all the details. Now, while I am going to be talking a lot about what dyspraxia isn't, I think one of the big things to point out is that dyspraxia definitely is a learning disorder or a learning disability, and that it does affect how somebody learns. Now, automatically people will assume, oh, so it's a mental disorder, oh, it's on the autism spectrum, or oh, it's the same as this or that. And that's not entirely true. There are plenty of different learning disorders that don't really qualify as mental disorders or as cognitive disorders specifically. So there are plenty of people who are bipolar who no one would consider that anywhere close to the autism spectrum, but because it does affect how somebody learns, especially in a school environment, they would still require the specialized personal or educational care that would be required for someone who may say have dyspraxia or autism spectrum disorder as well. And so yes, it is a learning disability, but not specifically a mental disorder. Dyspraxia is a disorder, but it itself is not a personality disorder. Things like dependent personality disorder, bipolar depression, etc. Personality disorders are things that affect human behavior mainly. Now, while dyspraxia may contribute in a positive or negative way towards a comorbid personality disorder, it is not itself a personality disorder. And while I know almost all of my subscribers know what I mean, just to put it out there for any outsider or someone who's just not that well versed in psychological knowledge who is also watching this video, comorbid means to have alongside something. So for instance, dyspraxia is comorbid with ADHD. So while dyspraxia is not ADHD, it can commonly be seen being diagnosed alongside ADHD. And this is where we get to the point where a lot of psychologists still kind of disagree. Many of them are generally accepting that dyspraxia itself is not a part of the autism spectrum, although it is comorbid with many autism spectrum disorders. So is it not? I personally don't think it is. It is more of a neurological thing, and I myself have only been diagnosed with dyspraxia and no other comorbid conditions. So being someone in that school, it would make sense to me to believe that dyspraxia is not really on the autism spectrum. But how we define the autism spectrum is always constantly changing. I mean, for the longest time, ADHD and dyslexia were also considered a part of the autism spectrum. And so I can't definitively say yes or no, but I'm strongly on the side of no, simply because autism spectrum disorder seems to be its own thing entirely, as we've come to find out. And yeah, so that's one of the bigger misconceptions that I feel like a lot of us deal with, simply because many of us are just kind of lumped in with the rest of people with autism spectrum disorder, or people with ADHD or so on, because a lot of these symptoms are similar. And a lot of what dyspraxia causes can be seen as similar to those that autism causes, except the reasons for these symptoms are slightly different. Dyspraxia is not a disease or an illness, but it is a disorder. And these are three terms that we tend to use interchangeably, but they really don't mean the same thing. A disease is more of an impairment caused by an external factor. A disorder is more or less just a behavior that many people usually show normally, but in the case of a disorder, it's just more enhanced. So for instance, insomnia would be considered a sleep disorder. While we all occasionally can't sleep, or we all occasionally sleep of variable amounts. An insomniac just can't sleep at all. It's basically taking something that is almost an everyday thing and taking it to one extreme or another, either a superior lack of said thing or a extreme exaggeration of said thing. So for instance, someone with generalized anxiety disorder would have a higher amount of generalized anxiety than the average person would. Now I would guess that about 90 to almost 95% of my subscribers come from the Dyspraxia subreddits, and one of the most commonly seen threads and one of the most commonly hated threads is the "oh, I'm pretty sure I have dyspraxia but I haven't been diagnosed yet." Now I think this is seen as a relatively common thing nowadays, ever since the advancement of the internet. I mean, it's actually a common meme that someone without insurance will go on WebMD with a cough and find out they have cancer, apparently. But the thing to remember is, although you see a lot of things on the internet, it's not a definitive answer to what may be wrong with you. See, while a lot of things on the internet are informative about what symptoms may go into what somebody may have, they don't take into account the context, and they don't take into account a patient history. See, for instance, there are many things that look like certain cancers, and it's understandable that not everybody has cancer, even if they look it up on Google and it seems that way. But when you actually go to a doctor and they have your patient history and they have the context as to when and how this happened and everything, it gives them a lot more information than just a list of symptoms. The symptoms tell the doctors a lot, don't get me wrong, and the symptoms tell a psychiatrist or a psychologist a lot, don't get me wrong. But at the same time, these symptoms alone are not indicative of a diagnosis. A diagnosis requires multiple different factors than the symptoms, because many disorders of various extremes have similar or almost the same symptoms. This is why many people who go to the emergency room with an illness and leave without having any answers tend to be so disappointed, because the emergency room doctors are only capable of doing so much and calling for so many labs and stuff. And so if you do have something serious, they're really not going to be able to help you until it's gotten to such an extreme that it would be apparent to an average everyday doctor just looking at you. Oh, one major misconception, since we were talking about autism spectrum disorder. Vaccines don't cause autism. They don't cause dyspraxia. Vaccines do not play any role in autism, dyspraxia, any of that crap. So if you're watching this and you're an anti-vaxxer and you haven't changed your mind yet, go. Oh, and one final thing. A lot of medical misinformation, like the ones portrayed in this video, claim to come from Big Pharma. A lot of the big conspiracy theorists like to blame Big Pharma for everything, especially those anti-vaxxers I just shoot away, hopefully. While it's generally debatable whether or not the United States healthcare system is at fault for this or not, it is also at least generally agreeable that many of these stories about what happens in Big Pharma and all these little corruption scandals are way overblown by the media simply so they can sell views and hits on social media. So while the healthcare system may not be as agreeable to many people as it really should be, it is important to remember that the whole medical system isn't corrupt. There's corruption everywhere. In almost any big privatized business sector, there's always going to be some semblance of corruption. And that's just kind of how life works, unfortunately. But it is not indicative of the whole industry. And there are plenty of pharmaceutical industries that are making breakthroughs and making tremendous leaps in scientific advancement. And to completely discredit the whole of pharmaceutical medicine or just the medical field in general because of a few bad variables is to just be short-sighted and to be completely misinformed because one thing gave you a bad taste in your mouth. So just try to keep in mind that yes, there's still a lot of misinformation out there, and yeah, our healthcare isn't perfect, but at the same time, Scientific advancements in medicine make medical doctors and medical professionals probably your most reliable source for psychological and medical advice. So keep that in mind. A lot of these misconceptions do come from people who aren't medical professionals, who don't know what they're talking about. Hell, I'm not a medical professional, and that's why I don't claim these videos are super educational or anything, and I'm always willing to revise them. But just keep that in mind, that, you know, while there is this stigma around mental health, and there is this stigma around dyspraxia and all this other crap, you know, it's really not the health system's fault. No matter where you are, if you're in the UK, if you're in the US, it's more of a media issue, and not even a media issue, but just a general misinformation of the general public, which isn't really healthcare's responsibility. This is where we get more into education and actually educating people on how dyspraxia works. And really, there's no one person to put the responsibility on. It's really on all of us, as well as, you know, psychologists, psychiatrists, student guidance counselors, etc. People who know what they're talking about should be able to spread this message so that there's a little less information. It's a little easier for people like you and me to be able to go out and openly talk about having dyspraxia. See, I've been watching a lot of the Joe Rogan Experience lately. Okay, come on, trolls, come and hit me. But Dr. Phil was on recently, and he actually made a very, very good point. People tend to view mental and personality disorders significantly differently than someone who has a generally accepted disability, like being blind or having the flu. But at the end of the day, we should be treating people with any kind of mental disorder, even chronic depression or anxiety, that we should be treating them the same way we treat someone who has the flu or who has cerebral palsy or who has blindness or deafness. You know, I don't think we should overly accommodate, because then it kind of makes them feel like they're definitely disadvantaged, but we shouldn't be suppressing their word either, and we should be taking into consideration limitations. So the next time somebody tries to say you're autistic, or the next time someone tries to self-diagnose themselves on Reddit, now you'll know better.